what's your perspective on how we're performing, how they're preparing themselves, and what ideas do you have for the future?
Well, I think a lot of our previous speakers started that conversation. We've really embraced quality, finally, as an industry. I've been in the field long enough. I remember when we used to have this quality-cost trade-off. You wanted more quality, you had to pay more. Well, the reality is, as we know now, that actually high quality costs less. And I actually also serve on the board of the National Baldrige Award. And I'm really pleased how healthcare has embraced that. 65% of the applications for 2010 are from healthcare organizations. And I think that alone is important, but even probably more important is the fact that now healthcare organizations, and my two colleagues here, I'm sure we'll talk about that more, realize we have to embrace things like, looking at Six Sigma and looking at ways to reduce, error in our services, reduce unnecessary waste. Just as we've embraced quality, now we have to embrace cost reduction, because we're not going to get any more money. We are being reimbursed as well as we ever will be in this country. And we're going to, in fact, get less money in the future per person. We're going to bring on stream 32 million people for healthcare services that have not received optimal care starting in 2014. We're going to have to do more with less. And I think, again, that fits right in with the quality movement that we've been talking about today.
So Rich, you want to follow up on that and talk a bit about the business model and what that means?
Yeah, we'll do that, Mike. I think part of the thing we have to be looking at down the road is, we can't look at quality and cost and safety in silos. They're not separated. They're all part of the equation. And I think the important thing to remember is when we look at these areas, we start with the quality equation, which then we have to build a cost model around. Which then builds a reimbursement model around. And I think eventually, as health systems, we're going to have to take ownership of that entire model in partnership with industry in general. And what I mean by that is the economics will be ours to run. I sit in meetings all the time with other CEOs, and all we talk about is more Medicare, more Medicaid reimbursement, and more charity care reimbursement. That's not happening. So I think organizations around the country have to take ownership of the economic model and reach out to the business community and partner with the business community and find that process that we keep people, bring them into the wellness process before they hit the sick care process, and build this continuum of care with an economic model around it. That's the only way we're going to be successful, because we're costing ourselves out of the process, frankly. Industry can't afford health care anymore, and we have to find different solutions, and that solution is partnership and controlling the economic environment. Economics will drive this process no matter what we think, and it's driving that process right now. So it's driving us to a different type of model, and the model is taking care of the population in a different way. And I think you've heard a lot of the conversation here this morning, and changing the culture inside organizations to do that.